It's the first state body, the advisory council body, to issue recommendations recommending limiting exposures as much as feasibly practical. They said the Maryland State Department of Education should consider using wired devices, and if a new classroom is to be built, network cables can be added at the same time, providing wired access. And I think this is really important to think about moving forward. Yes, it's complicated to retrofit, to change what's already in, although I feel it needs to be done. But if you're building new construction, then build it so that it's safe, with wires set up. And so the classroom is set up with the table set up so that there will be no tripping issues, and it will look great, and it will save a lot of money. And a lot of money in the cost to children's health. We need to keep that in mind. Sometimes we just talk about money in terms of the infrastructure and the cables and the technicians, but when you look at the impact of lead or any other smoking on our health, I don't think there's a comparison. Maryland State Children's Environmental Health and Protection Advisory Council. There are 19 members. Their purpose is to identify hazards that may affect children's health and recommend solutions. There are pediatricians, toxicologists, epidemiologists, and representatives from the Department of Health, Department of the Environment, Department of Agriculture. In the United States, after the National Toxicology Program released its results, finding increased tumors, they issued, and these are website pages, 10 safety tips for cell phones and wireless. And there's a page on healthychildren.org, which is the American Academy of Pediatrics for the population who wants to look up something about their baby, a page on these 10 tips. And also they responded with a press release article where Dr. Lowry, who's chair of the Council on Environmental Health of the American Academy of Pediatrics, stated, "They're not toys. They have radiation that is emitted from them, and the more we can keep them off the body and use the phone in other ways, it will be safer." And their tips include everything we know well, but also, really important one, if you plan to watch a movie on your device, download it first, then switch to airplane mode while you watch it in order to avoid unnecessary exposure. So in Maryland, where I'm from, the new legislation has been introduced to develop medical guidelines for computer use in school. And I just want to quote Cindy Eckert, a parent who really raised this issue. "I was shocked to learn that the Department of Education had no medically sound guidelines in place before they put so many children in front of a computer every day. And that's something to think about, is guidelines in terms of the eyes, in terms of posture, in terms of the radiation."
Published on specific absorption rate in the head of tablet users, written by Juliana Borges Ferreira and Alvaro de Salas. They created a realistic, anatomically accurate model of a child from an MRI. And they show this great absorption, just looking at the tablet here, into the eyes, right, into the frontal lobe. And Iris later, Dr. Udason, is going to tell us why she thinks that a glioblastoma in certain areas of the brain should be considered as a sentinel marker to suggest a cell phone exposure.
Take attention to this level, is 40 volts per meter. It's higher than the base station's limit. It's obviously it's a person, not a base station. Here we can see perhaps the difference in the wavelength in the air and the wavelength inside the head. We can do the calculations for the power density for this field, if you know the parameters of the tissues. Wi-Fi in the classrooms. Well, if we really adopt the precautionary principle, well, we should not allow Wi-Fi. We have another solution for perhaps the first priority is education. Yes. The second priority is connectivity in the classroom. Yes. But we can reach this second priority of connectivity in the classroom with wired devices. And if we really adopt the precautionary principle, it's obvious to use that.
I convinced them. And what is more important is that I'm responsible, not not the Ministry of Health, not Education Ministry, not Environmental Ministry. I'm responsible. So if later on there will be a problem, it is my fault. That's why.
And here is Baltimore County Schools, which is right in my neighborhood, and this is actually on their website about their tech department, and you see the device is right on her lap, and this is just a little excerpt, a clip from a video they have talking about how wonderful the program is. This is St. Augustine School in Italy in 2014, taking down the router. The Education Commissioner is disconnecting it, and it's sort of ceremonious, and I think
the testing, especially for long-term effects on children. And the people are not aware, they are not adequately informed, and many of them may have erroneous perception of safety of this technology. And on the other hand, there are good practices to be followed and alternatives which, if we apply those alternatives, then we can reduce exposure, we can reduce the risk. And how are you addressing this issue of wireless technology? First of all, we focus on houses and school, where, depending on the age, the children spend at least 60 to 90% of their time. We focus very much on policy level because we know we need to develop strong policies and eventually legislation. So we have an open dialogue at present to avoid Wi-Fi in School of Cyprus, with Ministry of Health and Ministry of Education. We are working closely with the parliamentary committees and with the Environment Commissioner in Cyprus, which are supporting very much our efforts in this area.
children younger than 14. Now, most recently in 2015, they passed policy where they banned Wi-Fi from nursery schools, and Wi-Fi routers must be turned off in the classrooms unless in use specifically for purposes by that teacher for the amount of time while the teacher is teaching it. And of course, the teachers should have wired computers for themselves. They also label Wi-Fi hotspots, so you have public awareness. You know I'm walking into a Wi-Fi hotspot, which is really important for pregnant women.
The body and create depression-like symptoms. Depression may come from mere screen time, and depression may come from children who experience shaming. So the three factors that the digital world is causing depression and increased suicidal behavior. The department at the psychiatric hospital for adolescents is now one of the biggest in Israel, is full. It's just full with children. There's no room for more. Who experience shaming, and they come after a suicidal attempt. And there are, we see in children tantrums, irritable mood, anxiety, withdrawnness and separation anxiety, nightmares, and there are many more other symptoms.
What Iris started off saying, that we felt that the epidemiology studies already performed enable us to say radio frequency fields are a probable human carcinogen. In terms of IARC, that's incredibly important because with the animal studies we've got and with the mechanistic studies we've heard something about, that would put radio frequency fields in category 1. That's the first point. The second point is that we did obtain information from a number of people. Unfortunately, you couldn't be here yesterday, but it became clear there's a lot of exposure going on and it's increasing. We have the issue in the Israeli military with exposure to radar and unusual cancers in terms of what we thought were likely to be increased by radio frequency fields turning up in greater proportion. Hematolymphatic cancers and testicular cancers.